Okay, I'm going to be mixing together some insulin. So I'm going to have to gather all my proper supplies. I have a alcohol pad, insulin, NPH insulin, and I check it against my MAR, and I'm going to be administering 12 units. And then my regular insulin, I'm going to be giving 22 units. I'm going to select the proper needle, the insulin needle, and I'm going to wash my hands and apply clean gloves. Okay. So I'm going to set that aside, and then I'm just going to double check that this is my NPH insulin, Novolin. Okay. So I'm going to carefully loosen the needle and set that down. I'm going to open my alcohol swab and clean the tops. And I'm going to roll to mix my insulin, making sure not to touch the top that I just cleaned. Roll to mix these. Okay. So first, I'm going to draw up air for my 12 units of NPH. Okay, that's 12 units of air. I'm going to put that into my NPH. Making sure not to touch the actual medicine. I'm going to take that out and draw up 22 units of regular. Okay, that's 22 units of regular. I'm going to inject this into inject the air. I'm going to turn it around and draw it up, making sure to get rid of all air bubbles. And being gentle with the needle. Okay, that's at 22 units. Then I'm going to have a fellow nurse check and verify that this is 22 units of regular insulin. And then I'm going to inject it into my NPH for another 12 units, going all the way to 34. So I inject it. Okay, no air bubbles. And then I would safely cap this using the scoop method. And with another nurse, I would ask him or her to look at this and verify that this is 34 units of my insulin mixture. And I would ask them to compare it to my MAR. And then I would clean up my area, throw that away, and I would go into my patient's room and check his or her glucose and administer the insulin. And then I would dispose of my gloves and do proper hand washing and document. Oh, I need a document that I have administered the insulin. So I would initial by the time and sign. And I would throw this in the shards container. Okay, and that would be in the trash.